This is Shannon Boucher. I am a former candidate for the OCDSB trustee position in Zone 6. I ran in Rideau, Vanier, Rockcliffe against Lyra Evans, who was the incumbent trustee and is now the chair of the OCDSB. Congratulations, I guess, to all the families and teachers that this little petty tyrant will create misery for during Lyra Evans' term. The OCDSB is meeting a special meeting tomorrow, November the 23rd, to talk about and debate mask mandates for all 72,000 students of the Ottawa Carleton District School Board and staff. Now, this is not a COVID mask mandate. In fact, it was planned in the summer. Lyra Evans tried to call an emergency meeting of the board in August to mandate that all children wear masks going back to school when there was no surges or public health mandates for masking in public spaces. Lyra Evans wanted to have this imposed by the board, and there was no takers. The board meeting didn't happen, but they have onboarded Zone 9 trustee Neely Kaplan-Murth, a doctor, supposedly, who is a mask radical, and I'll put a link in the description to her appearance on an Ontario talk show program. She's let's just speak plainly, she's a media whore. Who is constantly grandstanding in her virtue around dealing with COVID and vaccines. Jabapalooza was her idea, and she's continuing to use this kind of like, it's almost demonic possession and paranoia about COVID at this point, to insist that everybody wears masks. And she has said she'll wear a mask forever because that's the right thing to do for people. And she's using guilt and shame as tactics to belittle others who don't believe that the government should have the power to tell everybody what to do. She's a screaming banshee. And Lyra Evans is a totalitarian activist who is running the Ottawa Carleton District School Board, who has been wearing a mask herself since the beginning of the pandemic. And doesn't matter, outdoors, minus 25, wide open spaces, Lyra's gonna wear the mask. So what is this? We've had a surge, we know this. We've had a surge in CHEO, Children's Hospital Eastern Ontario. And there are long waiting lists at CHEO in the emergency room. And there has been an early sort of surge of RSV, which is a respiratory virus that affects kids. And a CBC article just a couple of days ago pointed out that masks don't really help this. RSV is spread primarily it affects young children under 4 most seriously. It's spread in daycares due to surface contacts. As you know, look, I raised 4 kids every year when they went to daycare. Got back to school, the latest virus would go around, the kids would be sick for a couple of days. And that has to spread, and that's how children build up their immune systems. Now, I'm not a doctor, but if you're a parent, you kind of recognize this pattern if you've been parenting for a couple of years. And unfortunately, the RSV has hit us, and for 3 years, kids have been at home. They've been isolated from other children. They have no exposure to these kinds of viruses. So all of a sudden, they're getting exposed and they're getting sick, which is natural and normal. And unfortunately, this one's a bit more pernicious, and it's compounded by a couple of things. One is, for decades, beds and resources at CHEO have been shrinking. And Alex Munter did a tweet thread giving some explanation of the challenges CHEO's facing. That was fairly extensive, illuminating all the different reasons why the resources that are currently available are insufficient to meet the surge in kids coming to the emergency room. Now, we also have supply chain issues, as we know, that affect all kinds of areas of our lives. One of the supply chain issues that we're currently facing is a lack of medication. A lack of cold and flu medication for children that might alleviate some symptoms and prevent them from the level of symptoms that might lead parents to say, "Well, we gotta get our kid to the hospital." Now, from what I understand, 5 extra beds were added to the PICU. That's the Pediatric Intensive Care Unit, doubling their capacity. So there's a capacity of about 10, and there are 150 total beds, if I got this right, at the CHEO Hospital, and that's down substantially from when CHEO was constructed. So let me pull up the Alex Munter tweet thread. Here we go. Why the current crisis at Children's Hospital? So why am I talking about CHEO? Because this is the justification that the OCDSB is using to attempt to impose mask mandates on 72,000 public school children. This isn't COVID, okay? It's a problem at the hospital. It's the same pretext that Liar Evans tried to use in the summertime, saying that Montfort was having problems, and so that everybody else in society, we live in a city of 1 million people, has to wear masks in order to deal with a healthcare issue in the hospitals, or a hospital issue of patient management. This makes zero sense whatsoever. It's the mark of a small mind to be pushing this kind of thing, and it's not being done for the reasons that are being proposed. So here we go. CHEO opened at 300 beds in 1974. That's just about 50 years ago. There are fewer than half that many. Okay, and there's some reasons for that. Advances in pharmacology, fewer kids. Pharmacology, that's medicines, right? So one of the issues is availability of medicines, but also we know that availability and access to family physicians right now is very, very difficult if you don't have a family doctor or a pediatrician. The walk-in clinics are no longer walk-in clinics. You have to make an appointment. There's been a whole bunch of stressors put on the system that are causing or leading to the backlog and the trouble at CHEO that have nothing to do with how disease is spread. Okay? Ottawa's child and youth population is now growing 9 times faster than Ontario's. This is great news. But because of COVID, mental health, behavioral diagnosis, things like eating disorders, cutting, anxiety, depression, all those things are putting pressure on CHEO. And that's something that we have to deal with. The government has been cutting dollars for healthcare and pressure on nurses. And the healthcare system itself has been stressed for the last 3 years because of COVID. Okay? According to Alex Munter, CEO of CHEO, children's health system was already too small before the pandemic. Too many kids waited too long. So now we add stressors that have nothing to do with how disease is spread. That's causing problems, and the response is to guilt and shame the public for not wearing masks. This is atrocious behavior. 35% of kids were waiting for surgery at CHEO longer than is clinically safe before the pandemic. Kids are now waiting, 50% of them are waiting longer than is clinically safe because of the respiratory viral surge. Okay. But if we know that it's spread through contact and surfaces and in daycares, the solution, according to a CBC article citing medical research and doctors, is to keep kids home when they're sick. Wash your hands. Okay, yes, Alex Munter goes on to elucidate. How many tweets is this? It's a 10 or 12 tweet thread linking to articles about all the reasons why CHEO is experiencing difficulty. Well, then you get down to the end and he says, wear masks. Well, Alex Munter, by reports of people close to him, is a very, very conservative when it comes to mask wearing. He's on the very conservative end of the spectrum, and he's at the particular hospital. Well, the the director of operations, or the whatever the role of CHEO executive that's playing into this OCDSB game of masking children, has no authority to do this in the public sphere. We're not getting mandate orders from public health. Public health officials who have strongly advised of wearing masks have been caught at public events indoors with many people with no masks themselves. So why is it, and on what basis are we going to allow these people to abuse their power to unilaterally and capriciously mask 72,000 students? Now, I have read from many, many people who have done a deep dive into the costs and benefits of masks. I have seen that the Ontario Nurses Union has won 2 cases against mandatory mask wearing to prevent the spread of flu. If I've got that correct, there are many arguments on the why wearing masks for children is detrimental to them for long term. One is speech pathology, because part of the way that we recognize communication is in facial expressions, and when we cover up facial expressions, we lose body language, and kids who have trouble understanding directions or who have auditory processing issues are unable to be able to use the full dynamics of communication between people. It degrades trust, it dehumanizes people, it takes away our sense of identity. And those are untold consequences that we don't even understand. But there is nowhere else in Canada right now where a school board is wanting to mask mandate their children. And so parents are called, and citizens are called, to object to this, to criticize it, and to mock Liar Evans resoundingly for the stupidity of making this her first official act. My name is Shannon Boucher. I'm a critic of the Ottawa Carleton District School Board, and I hope that you'll join tomorrow, 5:30 at the OCDSB offices at 133 Baseline for public gathering and protest against these capricious mandates.